In today's video, I am going to talk about the coronavirus and pregnancy, especially in Hyperemesis Gravidarum. Have HG or had HG, and whether you are in any of the three aspects, the before, the during, or the aftermath, then this video is for you. Hi, it's Dr. Strong, HGactivist, and welcome to my video. In today's video, we're going to talk about the coronavirus and Hyperemesis Gravidarum, all mixed together. We are living in the unknown with this pandemic. The only thing this can be compared to is
1918, the Spanish flu.
Back then, a lot of people were dying and dropping like flies, and it's scary, and that's the same thing happening here. I mean, this virus is gonna kill even more people before things get better, and it's scary. So should I get the vaccine? And that's a very, very good question. I do not like to get in vaccine debates, but I'm gonna be blunt because I don't sugarcoat it, okay? If you want a video of sugarcoating you and fluffing you to the end of the rainbow, it's not gonna be this. So you may leave if you like, or you can continue watching. There's not a lot of data on the vaccine, and it's in like warp speed productions, meaning that they're trying to get this done as fast as possible. The doctors on the front lines are the ones that are actually getting in first. Yes, people are having reactions.
Yes, people have died.
Yes, people have had anaphylaxis. There's a lot of people that are immune compromised, like myself. I cannot get the vaccination, and neither can my daughter. And that's scary. Now, a lot of moms that have the MTHR gene mutation, their children also have it. And the problem is, with our kids, they cannot break down the vaccinations. And my daughter is one of them. And from 8 months old and onward, she would get fevers, 105, 108. I mean, she was comatose in 2015 after vaccinations, and seizures, and I just told her seizures. And I'm scared to vaccinate her because of it. And I know that's a huge debate. Vaccinate your kids, you're the one treating her. Vaccines do this. And I was vax injured, okay? So I ended up getting the flu shot when I was 21. And I ended up with GBS, Guillain-Barré syndrome. It paralyzes you. It either starts with the tip of your fingers going numb, or your toes, and then it will spread, go up to your respiratory tract and your diaphragm and your lungs, and if it's not caught in time, if you are not put on a ventilator, you die. Adverse effects to it, and I am scared to death. If I got this vaccination, what it would do to me. Now, prior to not having anaphylaxis, I would have got the vaccine. But when I did Xolair, which was a treatment for mast cell activation disorder, it ended up triggering anaphylaxis, and now I deal with it every single day, and it's hard. It's hard, really, really, really hard. So you definitely want to talk to your doctor, your provider, because it's important, and you have to make that decision of, do you want to vaccinate yourself or your children? I can tell you that HG kids are prone to regression, to autism, like symptoms, ADHD, and you just don't ever want to see your child like that. It was debilitating. My daughter ended up on 5150s because of it, and it's just hard. Question is, Star, can the coronavirus really kill me and my baby? Data that we do have is very limited, because even though coronavirus is actually, people don't know this is the first coronavirus, COVID-19, that has caused a pandemic, okay? So I know that. Okay, there have been 2 studies. One study was 38 women who ended up having it, with coronavirus, but all their babies tested negative. But then we have another study indicating, this second study was in China, 33 newborns were tested for it, and 3 of them came back positive. However, this testing was not done immediately right after baby popped out. It was 3 days later. So we don't know if this was hospital contracted or it was actually passed down to the mother. You know, there has to be a lot more research. It's all ifs of, I don't know, I'm not sure, we don't know, data, need more, you know, scary times. So I'm here to educate you without sugarcoating it. So when you get pregnant, your immune system changes rapidly. So right there off the bat, you're at higher risk, okay? And you have to take extra precautions, okay? That means wearing a mask, social distancing, buying face shields, goggles. You need to protect your eyes, your nose, and your mouth. I'm going to show you how to put a mask on as well too, okay? Have Lysol wipes, have hand sanitizer on hand. If you clean the toilet lid, like I will physically show you how to do that, okay? Just so you understand and know, okay? This is going to be a series on coronavirus and Hyperemesis Gravidarum in all 3 aspects, the before, the during, or the aftermath. Okay, so coronavirus and pregnancy. Let's talk about it.
This week's shout out is to Stacy H. Thank you for always being here, dollface, and being so supportive of my channel and all of my activism. One of my other shout outs is going to go to Nicole S.M. Honey, keep fighting, HG. I know you feel at the bottom of the barrel and you just want to give up, but please know you're never alone. I look forward to seeing your comments.